First question is, asthma is not a serious condition and it is okay not to take medications.
No, so this is the biggest myth. So asthma is a very prevalent and a very important respiratory problem, and if not diagnosed and treated timely, it can progress and can cause irreversible airway damage. So it has to be taken seriously and treated as per the stage.
Another big myth around asthma is that it needs treatment only during symptoms.
Yes, so I also agree with you that it's a big myth that people go from symptom to symptom and they don't treat asthma in between. Asthma, if we try and understand, it's a condition of inflammation, which means that the airways are inflamed, and when they become inflamed and obstructed above a certain point, they produce symptoms. If we do not keep this inflammation in check, then we can keep on having asthma attacks, and every second attack is more severe than the first one. So an asthma patient needs to be on a controller medication despite symptom control. We can obviously up and down the medication based on the symptoms, and during certain months we might even totally stop, but you need to be on follow-up.
Another question or another myth rather we have is, all patients with asthma need the same medication and all inhalers are same.
So again, this is a myth only. It is saying that all tablets are the same. Every tablet has a different action because it has a different ingredient. Similarly, all inhalers are different and they have different ingredients. You might have similar ingredient with different brand names, but definitely the inhalers are different, dosages are different, and based on your asthma symptoms, based on your age, based on your symptom profile, we specify inhalers for different patients.
Another big myth that I have come across is that all inhalers are addictive.
So this is one question that almost 99% of asthma patients are going to ask us, that it is addictive. So no, there is no inhaler which has a medication in it which is habit forming or addictive. It is causing a symptom relief. If you are not taking the inhaler, you are getting the symptoms and you are trying to adjust to those symptoms. By taking the inhaler, your symptoms are getting better. So it is not that it is addictive, it is that you need it. Like you need water, air and food. You're not addicted to food. Nobody ever says that, oh my God, I'm addicted to water. So it is the need and not an addiction.
Another last myth around asthma that we've come across is that herbal remedies or alternate medicines can cure asthma.
So asthma is a disease of inflammation. Alternate therapies which basis you don't know, any herbal medicines which we don't know what it is, they may or may not treat asthma, but they can have harm to other organs of the body. You can definitely go in for things like deep breathing exercises, using masks, using air purifiers, shifting to a place which is less polluted, keeping your house clean. These things can go a long way, but definitely just taking some powders and all which you don't know what the contents are is not going to help you in the long run.